My name is Eva Nunez Paulino. I'm the Senior Administrator of the Outpatient Mental Health Programs. We help very vulnerable populations. Our clients have many difficulties with their life, let it be their diagnosis, let it be their attachment to community programs to be able to maintain wellness. So being open and for the clients to have a place where they knew was open, was available, someone who could still see you in person, regardless of the pandemic, and have a human connection was priceless. Acacia Network is open access to care. Acacia Network is a dedicated entire workforce to make sure that we deliver the best service ever possible to our communities.
My name is Jean-Pierre Lacour, better known as JP. I am the Deputy Director for the Community Association of Progressive Dominicans, which services about almost 1,500 to 2,000 kids. I think the biggest thing that I think myself, our agency, and our staff have learned, resiliency. We've been able to stay focused on the bigger goal of still serving the community, understanding the mantra of what we do in this community and what our partnership does and how that is established in the community. The biggest lesson is being patient, even against the hardest circumstances of the pandemic and changes within our society, was to then consistently work together as a team. One of the things we learned is figure out what family really means in the community. I would say the most definitive relationship issue that families had was the mental health, something that I think Acacia really does very well at. And our partnership here at the Audubon Center is to provide our community parents those mental health liaisons through our partnership and programming.
My name is Anna Gaultier. I'm a family nurse practitioner and I work at Clay Avenue. And part of the things I do here at Clay is seeing patients with HIV, hepatitis, substance abuse, and mental health. So I think the best thing is that I'm here with people that I love to work with. I don't want to get emotional because I could get emotional, but Acacia got me when I was a young little chicken. But I've learned so much from Acacia Network with the exposures of the patients. Of course, we love hospitals because that's our field, being in the medical, but to have that one-to-one and see a person come at their lowest in substance and mental health or their health, and then bring them to a point that they're so proud to say, look, I did it with your help, but I gotta remind the patient, like we always do, is you're the one that did it. We gave you the tools, we gave you the resource, but you were the one that did this journey.
My name is Michelle Maddox. I'm the Assistant Vice President of Skilled Nursing and Older Adult Centers. This COVID crisis really taught us how fragile life can be and how our older adult clients really are a vessel of wisdom and how they can teach us how to live more and love more. So I think we learn more from them than they learned from us. And I have to give them credit. They immediately jumped on virtual programming. They immediately supported us with the virtual and telephonic case assistants. And that just shows you how flexible and intelligent they are and how supportive they are of our programs in the community. So my team and I in the Institute for Puerto Rican and Hispanic Elderly were so proud to be there and still show up and be there for them. So the toughest thing for the older adults was, like I said, the isolation, and that connection that they still felt with us while we had to go virtual and telephonic, I think was very critical.
My name is Alejandro Epifanio Torres. I am the Executive Director of Loisaida Inc. Arts and Culture Center. The COVID-19 pandemic really hindered our ability to be open, for our community center to be open to the public. Notwithstanding, we had already foreseen the benefits of integrating a more robust virtual capacity, remote capacity, and this enabled us to retain 100% of our teaching artists working when a lot of other institutions were furloughing their employees. Isaida was able to adapt quickly to the new realities that this pandemic brought to organizations, especially small organizations like Isaida Inc.
My name is Tanya Jackson. I'm the Assistant Vice President of Social Services. Over the last 18 months or so, just the importance of having services provided to you by someone who's reminiscent of you. And when I say that, I mean, we work in very underserved areas, the Bronx, East Harlem, the South Bronx. So being able to provide services to all people, but Black and brown people, and the service being provided by Black and brown people that look like them, I really learned that it makes a true difference, because when someone feels as though you can understand and identify their plight and what they're going through, they're more likely to be successful in treatment and being honest and, becoming self-aware. And I always, laugh and I say to everyone, Acacia never says no. So like New York City, Acacia never sleeps. We're always there to answer and provide that assistance.
My name is Amaryllis Soler. I'm an Assistant Vice President with Acacia Network Housing, overseeing the portion of the portfolio that has the adult families, the master lease sites, the HPD shelter, as well as the DHS Tier 2 family shelters.
My name is Alfredo Matthews. I am Assistant Vice President with Acacia Network Housing, and I oversee the commercial hotel portfolio.
My name is Jessica McGee. I'm the Assistant Vice President for Single Adults with Acacia Network Housing. Being able to utilize Zoom has really changed our lives, right? It has really given us time back in our days, even though it consumes as much as it gives back. But it's given us time back in our days when we had to historically travel. Our entire teams needed to travel to one location in order to have a meeting, and that meeting took up your entire day. Now we can have a huddle, get the information we need disseminated very, very quickly. Introducing Zoom has allowed us to utilize all the technology that we have at our disposal. So we can better track our data. We can share data really quickly and utilize shared files. So that's been very exciting for our team, and it's really changed the way that we do our work now.
Nothing stopped. We continue to move clients out into permanent housing, even though New York City had literally stopped functioning. Somehow, somewhere, our directors, our staff found a way to find a room, an apartment to move clients out of shelter. And business just continued. We just found ways to adapt.
The acacia tree is supposed to represent life in the desert, right? If you find acacia tree in Africa in the desert, you found medicine, you found shade, you found water. And I feel like that's what Acacia Network is in this community has so much disparity, so much poverty, so much lack of access to services. Acacia creates that. Whether it's mental health, whether it's primary care, whether it's addiction you're struggling with, whether it's homelessness, whether it's job skill and development, whatever your need is, Acacia has that here. And so for me, Acacia is hope, Acacia is life, Acacia is future. For anybody who wants it, anybody who seeks it.
My name is Ronin Davis. I'm a Senior Director at Seedco. And in my role, I oversee all of Seedco's New York programming. So one of the biggest things that we do is workforce development, helping people get ready for the job market, access jobs. And it's not just about finding jobs, but finding sustainable jobs, careers, helping people get the training that they need to then be successful in their jobs. And once employed, helping them advance in those jobs, working with them on retention issues, anything that might come up that life happens and that can sometimes cause barriers to employment. Our job developers worked really hard to build relationships with employers, to talk to them about what their needs were, to work with them on what their hiring process was in the midst of COVID, and work with our participants to try and meet those needs. And so that partnership with employers and working with our participants, I think it just really demonstrated the commitment of our teams to the people that we serve, because we did see some good outcomes. And if they couldn't get a job at that time, we try to find them a training, we try to find them the benefits that they needed. And I think we had a lot of successes over the past year, despite all the difficulties of it.
Ya estamos otra vez llevando las ferias de salud, llevando salud a nuestro pueblo, y también ahora en los últimos pasados meses, tuvimos marzo, abril y mayo, entregamos casi $1 millón en compras a través de toda la isla, que se distribuyeron con otros compañeros y amigos en Puerto Rico que se unieron a nosotros a Acacia y nos dieron la mano para poderlo llevar a cabo. Así que se ha hecho mucho y nos falta todavía mucho más.
I am in awe. I am in awe of Acacia. Acacia staff did not miss a beat. Acacia staff, and it gives me chills, honestly, day and night, night and day. Acacia never closed. Our workers were essential workers in every sense of the word. You didn't have to be medical staff to be there 24/7. The coordination between the different teams, the exchange of information, the exchange of need versus the exchange of solutions was extraordinary. So I'm so proud of what is called the COVID response, but it does not surprise me. It doesn't surprise me because this is what Acacia does.
Gracias. Thank you for being there from day one. Thank you for your commitment. Thank you for believing that we were going to take care of them. Thank you for believing that this is the right place for them to be, for them to make contributions. Thank you because, like Raul said, when we all get asked years from now, where were you during COVID? I know that every staff that we have at Acacia will say proudly, I was providing services at Acacia when the COVID pandemic hit this nation.
Every single member of the Acacia family, from the board of directors to the executives, to the directors, the doctors, to the nurses, to the security guards, to the maintenance workers, to the kitchen workers, to every single part of the organization, did such an amazing job that I feel that I'm indebted and the community is indebted forever for what they went through to make sure that we were all safe, that our clients were safe and treated well. So to them I say thank you, thank you, thank you.